Sure.
Hopefully this is a more straightforward question. For your device guys, what strategy would you recommend for a company that small? I have a two-person company. We develop novel devices. But I know each step along the way of that development, the FDA requires product design review, design control stuff. How do you protect intellectual property without, you're getting people to give you feedback on your device?
Well, clearly the standards with working with a company like NAMSA are extremely high, and you put in place an NDA like you would with any of your suppliers that are potentially going to provide you product. If you're disclosing your secret sauce, then get an NDA in place and non-disclosure agreement in place with anybody initially. It's so important for you. Are you planning on taking your products all the way to market, or are you just doing certain development for another client?
Yeah, we're going market.
And I think this is another reason to get, I think NAMSA is an excellent resource for this as well, is to get an assessment done on the front end. Put an NDA in place with them. They'll assign someone to you that has experience in your general space, whether it's peripheral arterial disease or coronary disease or orthopedics, etc. And then you'll share with them who you think you're going to compete against, what technologies do you think you're going to displace, and let them help you build the roadmap. But until a few months ago, VMG or VentureMed was only a couple-person company as well, and we outsourced the writing of our 510K application. We hired people as consultants and contractors, and you can go to firms. NAMSA's resources there. Emergo is another excellent resource in the U.S. Or you can go to individuals. Ex-FDA people oftentimes put up a shingle and become great consultants as standalones. But I think that's it's not something that you can do alone, or should try to do alone. It's a lot of work. In your design history, because you're a medical device company, you have to comply with the design history file recorded. So in other words, the FDA is going to want to look at every decision you made. If you chose a polymer, you chose it for this reason, and what was the data that you backed that up with? You chose this metal, what was the reason you backed that up with? Halfway through, you changed your mind to go somewhere else. Why did you change your mind? Because that's all discoverable information if you have a failure several years out and you're wondering why did the pacemaker stop beating and cause injury to the patient.
So I think there's even more. It pays to invest up front.
Absolutely.
Yeah.
Yes.
Even though I know it is an expense for a startup, but I think it's one of those things that, especially in this game, you really have to get the experts involved early. So